Hi everyone, Sun Lion here. Welcome to Terra Lore Naturals broadcast. Terra means earth, lore means vast amounts of knowledge, and naturals is all about the different holistic healing modalities for the body, mind, and spirit, so you can feel your best on your personal journey to greatness. And before we get started with today's broadcast, I want to thank a very special group of people. First, I would like to give a big shout out to Eve and thank her for all of her love and support and encouragement for doing this broadcast and getting this channel going. And her technical support has been greatly appreciated because I am not tech savvy, but I'm getting there. And here we are with our first broadcast. Next, I would also like to thank my very dear friend Exanon for encouraging me as well to get this broadcast out to the people because it is a timely message. And thank you for the kick in the backside, my friend, to get me on the straight and narrow and encouraging me to keep going. And I would also like to give a huge shout out to Santa Surfing from Beach Broadcasting for keeping us up to date on the current news, along with all of the merry band of misfit elves in our little group. I love you all so, so much. And I love all of the support and encouragement that we have. And hopefully all of you that are listening will join our channels, and I will list a link below, and I'll get more into that later in the broadcast. So today's broadcast is about stress, trauma, and PTSD, signs and symptoms, and what to look for. So hopefully this will help individuals who are experiencing stress, trauma, or PTSD, but also individuals who are living with or know someone who has been diagnosed with one of these. This is going to be a two-part series where in the first part we're just going to talk about the signs and the symptoms, and in the second part we're going to explore some of the different techniques to assist individuals that have a diagnosis and what that might look like. So let's talk about stress. I put these in this order because stress is normally something that we all are exposed to on a daily basis. Stress is generally considered as being synonymous with distress, as it is defined as a mental, physical, or emotional strain or tension, or a condition or feeling experienced when a person perceives that demands placed upon them exceed the personal and social resources the individual is able to mobilize. I once read where stress, and this is a great way to describe it, stress is someone trying to resolve every situation solo. And that usually is the case when someone is feeling that they're under stress, especially emotional or mental stress. It's because they're just overwhelmed because they feel like they themselves personally have to do so much. Physical stress is when we exercise. We need stress in order for our muscles to tear down and rebuild. So some stress is good, but being constantly exposed to it continuously can lead to trauma. Trauma is an experience of severe psychological distress following any terrible or life-threatening event. Sufferers may develop emotional disturbance such as extreme anxiety, anger, depression, and that's only to mention a few. Trauma can be damaging experiences to mentally, emotionally, and physically, or a combination of thereof. So someone who experiences a car accident or some kind of physical trauma who has lasting physical injury can also experience mental and emotional trauma based on the lack of their ability to continue life as they used to. And then trauma can lead to PTSD, which is post-traumatic stress disorder. It is a condition that is triggered by witnessing or experiencing a traumatic event or caused from repeated exposure or witnessing events. PTSD is not, it used to be considered that it was just for veterans or combat individuals. Yes, they do experience PTSD. However, now there is new studies being conducted that are showing that children and domestic violence would also be considered something that could be a situation of PTSD. Pretty much whatever traumatic event that someone is witness to or has experienced can lead to PTSD. So let's look at some of the signs and symptoms following exposure to trauma. Now, I'm going to focus mainly on the cognitive, emotional, and behavioral. So, cognitive mental, you may have the individual blaming someone for their situation or their feelings or their emotions. There may be changes in alertness where before they may have been a very calm person, but then after experiencing a trauma, they may have heightened sense of awareness where they're always on guard, startled very easily. They may become confused, or hypervigilant would go with the change in alertness. There may be an increased or decreased awareness of their surroundings. This is what I would liken this to is if there's a decreased awareness, you may be having a conversation with someone and they may just check out. They may just not be there. They may not hear a word you're saying. They may have poor memory. They may have nightmares. They may have difficulty with abstract thinking, paying attention, concentration, decision making, and problem solving. Emotionally, they may be agitated. They may be anxious, apprehensive. They may not want to do the normal things that they used to do. They may not want to go out into crowds. Emotional shock. They may express depression or show symptoms of depression. They may feel overwhelmed. They may feel guilt, denial that they have a problem, inappropriate emotional responses, where you may encounter someone who it may, to some, may feel that it is not such a big deal, but to them, they're overwhelmed and their reaction can be overboard in reacting to something. They may be very irritable or they just may just lose it altogether for no reason. Someone may say something to them and they may just lose it. Other behavioral symptoms can be increased alcohol and drug consumption. They may withdraw, coming back to the emotional withdrawal, being antisocial, changing in activity. They may just not want to do things anymore. Changing communication, they may just cut off communication with everyone. There also may be changes in sexual function where it may just decrease completely or non-existent. Change in speech patterns where their tone may come across as anxious or angry. There may be, again, emotional outbursts. They may have an inability to sleep. There may be a change in their appetite where they may just not want to eat at all or it's decreased considerably. Pacing, and that goes back with the anxiety. There's just a tremendous amount of pent-up energy and or restlessness and they don't know what to do with that, so they just pace back and forth. Suspicious. They may be very suspicious of people, places, things, and they may create behaviors around that where they have to go and constantly check to see if the door is locked or if the windows are locked, or depending on what the situation is, the behavior may become noticeable and very different. And again, the social withdrawal. Now, for the sake of this video, I just wanted to pull out a couple and highlight them. Memory loss, poor concentration, and feeling overwhelmed. These are huge signs of trauma and PTSD. And youth who have experienced trauma or are diagnosed with PTSD, there's a new buzzword in the mental health field that's called ACEs, which is Adverse Childhood Experience. And with that adverse childhood experience, it can also be applied to adults. And what is found that children who have experienced trauma and or PTSD, the symptoms can be indicative of another diagnosis. So someone who has anxiety or a learning disability, it may not necessarily be as a learning disability. It may actually be that there was some kind of traumatic event in their life, giving forth the problems with memory in school, poor concentration, difficulty making decisions or problem solving, and those abstract thinking, as well as just feeling overwhelmed in school, which, if there's trauma that's misdiagnosed, a lot of times the avoidance comes in, and children and adults, children in particular, may not necessarily want to attend school, and they're not able to fully explain why. And that's also something that's very prominent with individuals with trauma or PTSD, is that they're just not able to express what they're feeling in that moment or what's going on with them. And it's just, I don't feel good. So a lot of times when they're feeling this way, I had this little Gurl-o-meter, because it's very frustrating for individuals to have this situation where they have words on the end of their tongue, they know what they want to say, but they just can't get it out. Not only is it frustrating for them, but it's also can be frustrating for the person that they're interacting with. So I would like to preface that if it's someone that you're dealing with that has PTSD or who is having difficulty articulating what they're trying to say, please be patient with them. We never know what the other person is truly going through until we walk a mile in their shoes. So patience and love and kindness really goes a long way. And one of the other things that I'd like to preface is individuals who have trauma and PTSD, a lot of the signs and symptoms are invisible. Just because we can't see a physical wound doesn't mean they don't exist. It's easy to sympathize and empathize with someone who has a broken bone or someone who fell and cut their knee or something like that, but it's difficult when the symptoms and the trauma is internalized and it's invisible. So here is a brain scan of an individual who has been diagnosed with PTSD, and on the right is an individual who has not. And as you can see in the prefrontal cortex, which is here in the front, where our cognitive reasoning skills are, this individual's brain is lit up like a Christmas tree. All this red and orange and yellow is the brain's activity due to their trauma. This person over here is considered, looking at this, would be considered normal brain activity. The prefrontal cortex is thinking, it's processing information, it's able to send output on a proper basis, where this one is just simply on mental overload. And being exposed to mental overload leaves the brain feeling like this. Just battery is empty. Some of the other important things to think about that I'd like to share. If you're an employer and you employ someone who has PTSD, or maybe it's someone you know, these are also some of the signs and symptoms to pay attention to. Again, we covered with the PTSD symptoms as well as trauma, that some of the symptoms are anxiety, but it may cause impairment in either work or school or home life. You may find that the individual is much more combative. There may be more conflicts and family problems. They may be more argumentative, or they may go the other way. They may want to isolate and just stay away from everyone. Different situations, they may have flashbacks. They may have feelings of hopelessness, intrusive reminders, which we would consider triggers, and nightmares, and they may do absolutely everything they can, like, to avoid these triggers. So school may be a trigger, or anything could be a trigger. It could be sound, it could be smell, it could be taste, it could be a place, it could be clothes, it could be pretty much anything. And reactions to those triggers can be very unexpected. The cognitive, again, that's the thinking process, may be very distracted, impaired concentration, memory problems, increased errors in school, at work, because of their inability to concentrate. They may lack confidence, and they may just have reduced productivity or give up altogether. Another interesting symptom to point out is that there is a very real physiology to trauma, and people experience fatigue and pain, changes in their sleep. Again, that goes back to the nightmares and the memory problems. Because of the physical fatigue, they may miss days at work or school, problems working shifts if they're working night shift, or change in routines, and they may just have reduced endurance. And their values and belief systems change because of lack of trust, and they may not want to talk about it because of a stigma or a belief about mental illness. They may just feel that no one understands them, and they may have disputes with coworkers and or school peers, and confidentiality concerns. So, seeking professional help is the most important thing for anyone who has suffered a trauma or PTSD. It is always very beneficial to talk to a professional. Talk to your doctor, your healthcare provider, connect with mental health professionals in your area. It is okay to talk to a therapist and fight the stigma. Join therapy groups or look for support groups in your area. Look for a family therapist who's trained in EMDR and CBT. I will be talking a little bit more about that in the next video. Secondly, be patient with yourself and be patient with the person who's dealing with this. Encourage them to keep a journal, write things down. This helps with their memory, helps keep them organized, remember their appointments, encourage them to learn their triggers, educate yourself and others, practice mindfulness and relaxation techniques. We'll talk about that more in the next video. Carry around an object that reminds you that you are currently in the present moment. People who suffer trauma tend to check out, and having that item in their pocket can help them to stay in the moment and to stay in the present and help them with grounding. Learning grounding techniques is also very helpful, aromatherapy and essential oil. Reaching out again for support groups, confide in someone you know. Cultivate your natural supports, and you would be surprised how many natural supports you actually have. Peer support groups, again, are very therapeutic, and in this day and age, 2020, 2021, online support groups are very beneficial. I cannot stress how therapeutic and powerful small groups are of like-minded peers can come together and be so loving and supportive. Also try volunteering, even if it's just half an hour a week, or pace yourself, whatever you feel. Start in baby steps. Try not to isolate yourself, especially in 2021. I know with social distancing and so on, it's very difficult to do, but try to not isolate yourself and communicate with people. Be honest about your needs. That is so important. People with trauma and PTSD do not want to be a burden, as does anyone else who has a mental health diagnosis. Work towards a healthy lifestyle, eating a balanced diet, also vitamin therapy. I'm going to talk about that also in the next video. Try to get enough sleep. I know people who have this kind of diagnosis have difficulty sleeping, but try to get at least 7 to 9 hours. If you're not sleeping, talk to your doctor about natural therapies and therapeutics that may be helpful. Avoid drugs and alcohol. There is a very strong temptation to want to self-medicate, which can only lead to more problems because alcohol is a depressant. Limit caffeine and screen time. If you're having difficulty sleeping, the last thing you need is to be wired up on caffeine. And speaking from experience, I love my coffee. I do. And limit your screen time because of the blue light. And it overstimulates the brain. So shutting it down an hour or two before bedtime. This is also very helpful with youth. Can also help calm the brain activity. And get moving. I mean, these are very self-explanatory, but the last one in particular, look into pet therapy or service animals. Animals can be so therapeutic. They love unconditionally, and they just are the most sentient beings. And I always encourage everyone to, when they're doing their natural supports, animals are right at the top of the list. But the most important thing for everyone to remember, whether it's stress, trauma, PTSD, or any other mental health diagnosis, you are not alone. Since May is Mental Health Awareness Month, I really wanted to bring attention to this topic. It is something that is very near and dear to my heart. I really hope you like this broadcast. Please stay tuned for part 2, where we're going to talk about the different healing modalities and techniques that you can do at home. And I will walk you through an exercise, and we will discuss some vitamins that will also help, and some diet and nutrition. Also, I wanted to add that you can find me, Sun Lion, on Anon Up. That is my social media platform, or you can find me on Telegram. I will list the links below. Terralore Naturals chat channel, where you can jump in there and chat with other people that are in there, post questions. I hang out in Telegram. That's mainly where I am. And there are other groups in there as well, and I will list their links. One of the merry band of Mr. L's is Italia Girls prayer and chat channel, where You can come together and ask for prayer and just chat with other people. And again, I will list all of those links below. So I would like to thank you for listening. Please like and share, and may you always enjoy the love of learning. Take care.